Thanks so much. Thanks so much for having me today. I'm really excited to share with everybody the Foreign Agricultural Worker Strategy. Now, you'll notice that I've put May 15th, 2024 as the date on this. The reason I've done that is it's the same deck that I shared at the beginning of the strategy, and we're continuing to share along the path. So I wanted you to know that authentically, this is the exact same deck that we shared, no change in messaging, and we continue to share this strategy as it existed from day one and what we're working towards. So again, my name is Kendra Holliday-Bryant. I'm a project director here at the WSIB within case management. I've been with the board nearly 20 years. I'm about 19 and a half years in. It's exciting times at the WSIB. We're really going through some great change. And one of the greatest changes that we've made recently is this particular strategy. And we're really excited to continue to work with our partners, our stakeholders, our growers, as we work through this, this change here at the WSIB when it comes to how we handle cases for participants in the seasonal agricultural worker program. So let's just go through a straight high-level agenda overview here. So we're going to talk about the foundations of the review, why it started, why we're here. I want to talk a little bit about what we heard along the path. We heard a lot of stuff when speaking with our stakeholders, our employers, our worker advocates, our legal community. Lots of different people had opinions on where we should be going internally and externally. And then we were going to move straight into the strategy itself. It's a three-pillared approach, so we're not here alone within case management. There's lots of different moving parts because we found through the strategy and through the review that, there was a lot of things that we had as an opportunity to really help our growers. We're going to talk a little bit more of the meat and potatoes of the current state versus future state of case management. Now, when I say current state, I mean pre-September 2023, when we started our review. Okay, I've kept it as current state for now, just to really kind of hit home how we used to do things and how we're approaching things now. And then we'll open it up to a discussion. So let's dive in a little bit into the foundation of the review. So what happened? Why were we here? So if we think back to September 2023, on September 15th, 2023, actually, we had a batch decision issued to us from our Workplace Safety and Insurance Appeals Tribunal. That batch decision had been with us, had been in existence or batched together for quite a number of years. And the WSIB had made it clear that they were working towards a decision and understanding how a suitable occupation is determined for a participant in the seasonal agricultural worker program. That was the crux of the issue within these 4 leading cases.
And Kendra,
okay.
can I just ask you to, with the acronyms, the WSIB is?
The Workplace Safety Insurance Appeals Tribunal. So that's who issued the leading cases. So that was the appeal, the highest level of appeal, okay? So when we got that decision back, we quickly shifted and said, you know what? We hear you, and we're going to dip into a review. We want to basically from end to end take a look at the opportunity for programming and services delivered by the Workplace Safety and Insurance Board for agricultural workers and their employers. Key there, and their employers. This isn't just one party, it's both parties. So from this, we wanted to make sure that we were clarifying the adjudicative process for injured and ill people participating specifically in the seasonal agricultural worker program. Okay, now I know we're going to have some questions. What does this mean for the 2-year program, for the other programs? We really needed to focus in on this seasonal agriculture worker program because that's where the practice applied. I want to be clear by saying practice versus policy, because it was a practice, it was not within our policy at all. So we looked first at establishing a revised adjudicative approach to apply to SOP claims, so that's seasonal agricultural worker, I know you guys all know that one, when defining available as it relates to their local labor market. Again, going back to that batch decision, that was what we were focusing on, and that's what we were asked to kind of look at, or we chose to look at. We also needed to determine an implementation date for this revised approach, which may result in the retroactive adjudication and adjustments to prior decisions. So when we looked at it, we also knew that this decision had been used for quite a number of years. So we had to peel back the onion a little bit and take a look at those, because the decisions were coming the same pathway through WSIB every time they were taken there since that batch decision was issued. Then we were looking at developing a comprehensive future state approach that includes a case management refresh, prevention and compliance, and communication and engagement. So that's where we're going to get into our strategy itself. But before we get there, I want to talk a little bit more about what we heard. So when we were talking to employers, when we did some engagement with employers, one of the things that we did hear is just how there was confusion around how WSIB dealt with SOP versus temporary foreign agriculture stream workers. So there was that confusion about coverage. When are they covered? When are they not covered? When to file a claim? When not to file a claim? So that we thought, okay, well, we need to dig into that a little bit more. From our staff internally, we really had some challenges with connecting with injured and ill people to monitor that recovery and return to work once they return to the home country. So when they leave our country, and you'll know this as well, there's technological barriers in connecting with them, and WSIB is still very much reliant on using the phone. So those were some of the things that we really needed to kind of dig into more to see if there was opportunity here. We also had the difficulty in issuing payments for both our injured and ill people and their healthcare providers. That's a problem. If we can't pay them, we can't help them get better, it's harder to bring them back into the program. Our consulates, really, we had some aha moments when we met with our consulates. They really helped us understand that there's some cultural differences for service delivery. So, for example, one of the things that we heard from the consulate of Mexico was that it's customary to interact in person versus over the phone when dealing with the government in Mexico. So you're going to go into an office, you're going to talk to them face to face, and then you can get all the papers that you need and you'll fill them out together. Well, WSIB, as you know, we're in a predominantly remote. I'm here from my home today. So because we're predominantly remote, we're picking up the phone and talking to people. That's a disconnect, and that doesn't build trust in the recovery and return to work process. Our representatives also identified the payment barriers once an injured or ill person returned to their home country. So that again was for the providers and the injured and ill people. So again, pain point we're hearing in two places. That's not good. And then just collectively, when we started talking to everybody, there was just this lack of understanding of when to report a claim, available benefits, what are they entitled to, and then the responsibility of different government agencies, administrative burden, et cetera, et cetera. So we think about, the different government agencies. We know the layers, the layers, right? I'm preaching to the choir here. When we say, okay, so we start off at the federal level and we have our different agencies that are involved in there in the LMIA process and the visas and whatnot, and then they're getting them here. And then we have the provincial government that's involved when it comes to the OHIP applications, making sure that, you've met all of those needs and you have WSIB at that level if they have an injury. We get down to the regional level and we're township level, we're dealing with, our health, our public health organizations. We're also dealing with, our construction bylaws and everything like that. So layer all those on, I can understand how employers were frustrated, confused, and really just didn't understand when to go where. And that's something that we carried through COVID as well. I remember talking to many of you when outbreaks occurred, and you said, but I dealt with that, except we still need to deal with WSIB. So we want to make it, kind of easier to deal with the WSIB and make it less of a burden for you, because we know that you have so many important things to do on the daily basis running your farms and your businesses. So this leads us to our strategy. Okay, this is what we're really excited about. So our objective really was to develop that comprehensive future state that aims at delivering a refreshed approach. So you'll notice when we look under the approach column here, we've got 4 pillars. And we call it or 3 pillars, I'm sorry, 3 pillars. We have 3 pillars. And we call it a pillared approach for that exact reason. So we're working collectively together as one WSIB when we're delivering this and when we're working towards implementation of the strategy, but we also want to make sure that we identify what pillar that falls into so that we know who has responsibility or carriage over that and who we can lean on to help support our stakeholders. So let's look first at prevention and compliance. And we hear compliance, we go, oh gosh, what does that mean? I'm going to dig into that a little bit more for you. So we are going to partner with workplace health and safety services. So think about our health and service safety excellent program. They're the people that run that program. And see what kind of other opportunities we have for the agriculture industry to both look at programs for injured people and their employers. So taking a little bit of a different view. So they're working towards some initiatives to see what we can do to help support that. We're going to develop a strategic approach by 2025 for this group of individuals to help support you and your employees. So looking at that prevention piece, specifically when it comes to those new Canadians or foreign agricultural workers. Monitor compliance within the sector. Now, what we mean by this is we're not coming out to make sure that, you're compliant on every aspect of things. What we mean is we want to make sure that when we change things, that you feel supported and that you understand what that means in regard to claims for filing WSIB for injured people and how you're supported in reporting and all of that. It also means that we're going to make sure that our staff understand what potential fraud looks like, what it means to have claim suppression. Those different things is just making sure that our staff have the tools in their toolbox to be able to support you and answer any questions you may have, but also make sure that we're really looking at the sector itself to ensure that they understand any changes that are happening. So that's where our compliance partners are coming into play. And then we're just looking at that sector specific training that we talked about. So we've completed that training. We've checked that box. It's been done. So our staff have received it, frontline, our teams that deal with the agriculture claims in Guelph. And then we just completed on Friday our return to work specialists, which are the ones that you're seeing on the farm face to face when you have an injury. Now let's look to communication and engagement. And I'm noticing when I converted this over that we have some, I've got some issues with my tabbing and everything like that. So I'll make sure I'll fix that for when I send it out to you, Stefan, to share, because I can share this deck with you all. So when we look at communication and engagement, we were really, really good. And I was guilty of this myself. Okay. So when I went into the stakeholder relations role, my previous role, I got really excited. I want to do all this engagement. I want to be out there. I want to be communicating. I want to be connecting with people. Then we started to share how we handled claims, and it didn't always feel the best because it was hard to explain something that wasn't ingrained in policy. So if something's not supported in policy, it makes it very, very difficult to be able to explain to an employer or an injured person or their group or advocate why that decision is arrived at, because we ground everything within policy, within legislation, but this was a practice. So defending that became very difficult. So we kind of lost steam and momentum there. So this is us renewing that and refreshing that engagement, doing discussions like this today, engaging with our stakeholders and saying, we're here to stay, we're here to connect, and we want to make sure that you feel supported, that you understand that everything that's happening and the changes that are occurring, and that you understand what services we have available to you. That is our role and goal of this strategy. So we're also going to be working with our consulate and liaison services. We're only as good as those that support injured and ill people, as well as their employers. And we know that our consulates are a great resource for us, as well as injured people, when it comes to that return to work and recovery process and understanding their obligations. We do lean on them, especially when there's situations where somebody may be trying to move within the system and it's not moving fast enough for them, but we want to make sure that they're able to recover in Ontario, and that's where they can help us. I can tell you that we've met with already many of our liaison services. Well, we met with all of our liaison services and the Consulate of Mexico, and they've been positive meetings to date. One of my favorite meetings that we've had actually was on May 14th. We met with Jamaican Liaison Service and their ministry back home. And after we left that meeting, we all kind of looked at each other and went, it's one of the best meetings that we've ever had in our careers at the WSIB. And I can tell you, I was surrounded by a lot of people that have been here a long time. The reason it was one of the best meetings is we felt that collaboration. We felt like we were all there together to drive to an outcome that makes sense. The reason we were meeting with them was really to understand if we have to go to a suitable occupation in home country, what does that look like for retraining, and how do we support an individual? But how can we also support return to work in Ontario following a workplace accident when they're involved in the SOP? We also need to integrate better with our Canadian departments, ministries, and agencies. We need to be working together collectively because we only own a little small pathway, a little laneway of this entire big machine that is foreign agricultural workers. So how do we integrate within that process, and how do we work together collaboratively to make sure that our message is being heard, but we're also supporting the messages that the other agencies have, and what we can do to make sure that we're directing to the right pathway when it comes to those kinds of conversations. And then, of course, we want to work with our Associations of Workers' Compensation Boards of Canada. So AWCBC, that's that big long acronym. It turns into that little short acronym with all those letters. um, we meet with them on the regular through benefits and compensation. And the purpose behind this is making sure that we're aligned, that they know everything that we're doing in Ontario, because I can tell you we're the only jurisdiction that has shifted to suitable occupation in home country at this point. Doesn't mean that others aren't going to end up there, but we know in Ontario we've shifted that to meet the batch decisions. We also have made enhancements to WSIB.ca and refreshed information on foreign agricultural workers and SOP participant pages on our website. We've also launched a dedicated page to our strategy. We haven't had a lot of updates yet because we're still kind of now implementing that strategy. So we haven't had any big updates yet, but we will have some coming in the next couple of months, which we're excited about. So we're going to continue to enhance that information. Some of the big wins off the top, though, is we've had some translation to Spanish of all of our pages that really do impact our foreign agricultural workers, which we didn't have before. We've also made sure that our brochures have been updated to meet our current branding, as well as information sharing with regard to the programs itself. Now let's go to the third pillar, case management. That's when a claim happens. These are what happen. These are what we really need to focus in on. This is what the main message for our employers here today. So one of the things that we really are focused on, and you would have heard through a lot of our messages around the media attention back in May, was that focus on recovery and return to work in Ontario. And a lot of people go, well, what does that mean? Well, what that means is we're here. We're here to help and support you. We're here to really make sure that you understand the process and that we're there along the path with you. We're there for the injured person to help with recovery, and we're there to support return to work to ensure that it's safe, suitable, and accommodated. And we can provide resources to you. We have a wonderful program with an accommodations team that helps our return to work specialists. And if there's a case, and we're monitoring this very quickly by doing, or closely by doing dual referrals to our accommodation team on every single file to make sure that if there's something that we can do to help with accommodation in the field, pun intended in this case, is to ensure that we have those available. They've done so much research and so much background, and we're hoping to actually utilize that information and data collection to create some best practices, or possibly even provide the industry with some information about, what tools might be better used to prevent injuries. So that's what we're hoping to kind of build that into long term. We have kind of our short term and our long term goals in all of this. We've also amended identification of suitable occupation to account for the home labor market. Now, this is only when we've, similar to an Ontarian worker, where we've peeled it back, and we just can't get return to work with the employer. It's just too many barriers with the injury or whatever the case may be. So in those particular cases, we are now going to be looking at that suitable occupation in a home country, which we didn't do previously. We'll get into that current or versus future state on the next slide. We're also aligning payment of loss of earnings between contracts to reflect lots of earnings. We're still looking to figure out what exactly how that works, but really what we're looking at, and this is what I want you to take away from the bigger picture here, is we're looking at using actual earnings. In the policy itself, we talked to the notion of using probable EI. Well, as you know, they can't collect probable EI, or they can't collect EI because of the federal level's limitations on that. So then that's not really an earning that they've got, but they do have earnings in their home country. So how do we then bring that into their long-term rate, which we use when somebody does have an injury? And what does that look like? If they work during if they don't work during or between the growing season, what does that look like? These are all the questions that we're asking ourselves, okay, as we look at this and as we work towards that updated policy. Now I've gotten here, develop a new adjudicative practice document. Initially, because that's that forward-facing document that we have. Initially, we thought we were going to need one. However, you'll recall when we did our communicable illness, you may recall, when we did our communicable illness policy that launched earlier this year, maybe late last year, that we developed it, and it's really comprehensive and user-friendly. The purpose behind that is actually when we talked to policy and collaborated with policy, we said to them, we're like, we don't want to have to write a practice document. So they're now taking that with all of their policy updates to make sure that we don't have to have supporting documents to explain the policy. So when you read the policy, you can understand what we're doing and why. That's the intent with the refresh that we're doing. We're going to make sure that we're ingraining everything, all the good things with the review in that updated policy and future-proofing it. We have a little joke internally. One of our managers in Guelph, many of you will maybe have spoken to him over the years, Gary Dory. He said, I don't want to be doing this again in 5 years. So I promised him he wouldn't have to do it again in 5 years by making sure that we're just updating that policy to really help everybody understand what we're going for. So normally at this point within any strategy at the WSIB, we would talk about, savings or how we can improve and impact metrics. It's not what this is about. This is really about meeting our vision while living our values. So we want to make sure that what we're doing is better. It's consistent case management practices to enable a better customer experience. We want to make sure it's easier. A refresh dedicated page on our website that's going to make it easier to locate information related to this particular group of individuals and workers in case of injury or illness. And we also want to make it faster to deal with the WSIB by removing these technological barriers that really exist for foreign agricultural workers when interacting and their providers, specifically when connecting back home. But again, we also needed to make sure that our values were met. So we were holding ourselves accountable to make improvements and review the retroactive options I'm going to talk about in a second, because I know that's going to be on your radar. We were committed to collaborating. I cannot say enough. When we went through the development of this strategy, we leaned on a lot of different business areas to really take this one WSIB approach. And the reason behind that is we don't just own it here in case management. Everybody has a piece of the puzzle. We're all here to support our stakeholders, including our employers. And what that means is we needed to make sure that we were working together versus against each other. And so we leaned on people's during their very busy times of the year. So actuarial services during their year end to say, hey, can you help us with costing? And they were there. They dropped in and said, yeah, we're here for you, which was a pretty amazing. We're taking an empathetic approach when we're talking to people and having those conversations to really understand the experiences and challenges of this population. But we're doing this all with integrity. We remain committed to doing what we have said we would do, which is really important to us. So I want to dip in before we go into that current future state slide, and before we get to our discussion, to talk a little bit about the retroactive piece. So you'll remember, and as part of our launch, we talked a little bit about retroactive, and that we do have some of these decisions that we are revisiting. And the reason why we're revisiting these is we know that many of these cases were already headed towards WSIB, and WSIB has been issuing the same decision over and over and over again. So really, we were going to have to go, we weren't going to have to go back, but we wanted to go back because it was the right thing to do in these cases. We had made a decision based on a practice that we see differently now, and that was really important to us. And I can say that this was supported from the top down. This was supported from Jeff Down, our president and CEO, from our chief operating officer, Gavin Pogan. They were committed to this change. So the approximate number of cases that were implicated in this decision was about 58. We started digging into them a little bit more. That number has gone down a little bit because we found out that they were in a different program. They've come back to work. This was the great news that we've kind of learned through many of these cases so far. We're about halfway through digging into them. Many of these individuals re-entered the program. That's great. That means that our employers are finding accommodation for them, and they're able to return year after year to do the work that they came here to do, earn money for their families and return year after year. And that made us very excited about the outcomes. But want to make sure that you also take away from this message is that these retroactive cases, we're making sure that they're not showing on the cost statement for the employers. So we changed the rules. It's kind of hard to keep up if we change the rules when it comes to costing. So for those cases, the retroactive cases, we're making sure that we're accounting for those, but we're also making sure that we understand what that means going forward for employers and what we can do to support you when an injury occurs on the farm. And those are some of the deeper dives that we're going to do in some of our future sessions. Today is just really about the big picture and the takeaways and what you really need to know. Okay. So let's talk quickly about current state versus future state. So when we look at current state, current state being that September 2023, we look at what we did historically. So when we do this when looking under, looking at loss of earnings benefits and return to work services, those are two primary kind of sections of our legislation that we are honing in on through that conversations that we are having within our broader working group. So in our current state, that pre-September 2023, what we typically did for a SOP participant when they went home or repatriated, and they continued to have that workplace injury, we applied a practice of paying loss of earnings benefits based on a suitable occupation in Ontario labor market. So think about that. They've gone home. We're saying they can work here in a suitable occupation that they can't work in, and then we pay them for 12 weeks in lieu of a return to work services. And that's a bit of a gap if you think about it, because they can't do the work here, but we said they could, and we didn't provide them any services. Now, I know we kind of think about that and we go, it's kind of backwards. That practice has been in place since 2012. Okay, so just remember that. If you think back to 2012, where were we technologically? Would we be sitting here in a virtual room having a meeting? No, we wouldn't have been. Would we have been able to connect it with another country virtually? Not easily. So I think the pandemic was actually a good thing when it came to foreign agricultural workers, because it allowed us, it gave us the space, the technological advancements to be able to provide these services in another country while still in Ontario, which is pretty impressive. And we're excited about that. So we're not sending a big group of individuals from WSIB to Jamaica or Mexico. That's not happening. We're doing it virtually, which I love, because that means we're able to connect with people. We're able to provide them the services that we would in Ontario, but we're also able to leverage connections with other countries and work collaboratively like in an international community way, which is pretty amazing. So in those particular cases, that was a practice from 2012. And just to keep in mind, those who were unfit for so those were for people who were fit for work in some capacity, but weren't going to fully recover. For those that were completely unfit for work, really their injury prevented them from being able to return into the labor market, we would continue to pay loss of earnings. That's similar to somebody in Ontario. No difference there. We would then pay full loss of earnings when a SO in Ontario wasn't identifiable. So we really just couldn't find something that they would be able to do in Ontario due to many things. When we look at an individual in Ontario, if there's, we sometimes look at the notion of competitively unemployable. And what we mean by that is, there's so many barriers beyond just the workplace injury that really prevents them from entering into the workforce. Again, typically we would find a suitable occupation that they were capable of performing. And we would put it on their file and say, yep, if you were here, you would be capable of doing it. And then we would remember I talked about on the other slide, we would calculate the long-term rate using probable employment insurance. So we're peeling that back as well. We're looking at that from the notion of they do earn in their home countries. And if we think about the SOP participants specifically, what's interesting is out of all of our workers that we deal with at WSIB, our injured people, they are probably the only type of worker that will have earnings in two different, very, very different labor markets during any 1 year. So we need to consider that when we're looking at our policy refresh or our policy update. So now when we look towards our future state, we're still kind of nailing down what this looks like, but essentially what we're looking towards is those that are participating in the SOB, when they return home, their compensation will be reflective of their ability to earn income in their local labor market based on their function in relation to their injury and illness. And it's going to take into account loss of earnings between returning home and returning back into the program. So remember when we talked about return to work and recovery in Ontario? That's where we're implementing along the path some other actions with our return to work specialist, talking about what the next growing season looks like for an individual and how can we help put in place a plan to bring them back to support the employer and to support the worker and to provide everybody with the information prior to repatriation. So those are the little things that we're looking at already. And I know that we're actively, some employers have already experienced this and are really working through it collaboratively through us. And thank you for that. Because if we can help them recover in Ontario, we get more information medically, we get more information, we get speedier healthcare treatment because we have so many great accessible programs through our different programs at the WSIB that it really does allow for that robust recovery to occur here in Ontario, and it's immediate. It's happening while the person is still here, while the injury, they don't have those delays when they return home. And those are some of the barriers that we run into, which can prolong recovery if we don't have that treatment. We will be looking to identify a suitable occupation in the person's local labor market based on their physical abilities and function. So similar to somebody in Ontario, we look towards their local labor market. So if we have somebody who's up in Kenora, we're looking at their local labor market. The same thing is occurring if they live in Jamaica. Now, here's the thing. This is when the workplace injury prevents them from returning into the program. Okay. So if it's well beyond it prevents them from returning, then those are conversations that we're having. We're not going straight to suitable occupation in home country. We want to work with you to bring them back into the program and what that looks like. And we've had some really good understanding from our consulates and our liaison services about what that can look like and how we can support you through that process. Again, if they're totally impaired, we're going to pay that full loss of earnings. Nothing's changing there. And then the long-term rates of the LTR there, you'll see it's going to include a review of the person's earnings history to be more reflective of the employment pattern and earnings that they have. So again, treating them like an Ontarian worker, we look towards our past and what we earn here in Ontario between contracts. Somebody may have a layoff period. They may not work during the winter months. Those are the sorts of things that we're taking into consideration. And it's really going to be reflective in the employment, the long-term rate calculation. And then if there is an ongoing loss of earnings based on between those contracts, we'll look towards seeing what that would look like from a payment perspective. So those are all the kind of nuances that we're looking towards in the future state. So I keep saying this updated policy. You're probably wondering, when is it coming? When is it coming? Same question here. But realistically, we are looking towards having it by the end of growing season right now. Our policy department is working very, very diligently on this for us. They know that it's a priority that needs to be addressed so that we can help support our employers and stakeholders and our injured people for the next growing season and beyond. Now, there was one piece that I forgot to mention about the retroactive piece. So when we talk about the retroactive piece, you probably are wondering date. I know it was out there in the media, but I'll just refresh and remind you. We're going back to claims to 2007. The reason behind 2007, because a lot of people kind of wonder, why that date? Well, 2007 is aligned with when really that notion or concept of available came into our legislation, which made sense based on the batch decisions that were issued. So we were just aligning with that as we moved into consideration for the retroactive piece. And those are when we started making those decisions around that suitable occupation here in Ontario that they weren't able to perform. So it kind of, all the pieces kind of fell into place to make sense to go back to that 2007 and felt like it was the right date to anchor our retroactive decision to. So again, just underlining or underpinning there at the bottom, if somebody is unable to work, we look towards paying them full loss of earnings. So those serious injuries, those claims, nothing changes for them. We continue to support them because we do have, that is the one thing we do have within the agriculture sector is we do have significant injuries because we're dealing with really heavy equipment. We're dealing with lots of, moving parts, simple machinery, if you will, but also complex machinery that can cause injury along the path. So those are just things that are remaining the same because it was a good practice that we already had. So why change what isn't broken? I want to be cognizant of time. So it's 12:35. I've thrown a ton of information at everybody. I'm sure you have some questions, so I'd be happy to open it up to questions at this point, if anybody has any. I can stop sharing my slide as well, I think, maybe.
I mean, just maybe keep it up.
Okay.
Just in case people want to go back to a slide.
Sure,
So,
sounds good. I'm not able to move something anyways on my screen, so it's not closing for me. Okay. Do we have any questions in the chat? I haven't pulled it up.
yeah, thanks, Kendra. And I'll let you kind of self-moderate. I encourage people to type your questions in the chat.
Yeah, I need to find the chat. Here it is. There we go.
If you can't find the chat
I've got
at
it.
the bottom of your screen, folks, then you'll hopefully see at the right side of your menu at the bottom, more, and you can click, those are the three dots above the word more, and then you'll see chat as one of the options, and you can type in your questions in there. Another option is you click on the reactions button and raise your hand, and then we can take questions that way as well. That way you don't have to type.
Okay, so you said TFW don't qualify for EI. So that's specific when they return home. I know that there are sections, and I should have been clear about that. There are sections where employment insurance doesn't apply for a temporary foreign worker. Here in Ontario, here they can when they're in Ontario. I don't know the ins and outs and nuances of that, but it's specific when they would have a layoff and they would repatriate and go back home at end of contract. Here in Ontario, if you had end of contract, you would qualify for employment insurance. We do know that there are for foreign agricultural workers when they repatriate, that's not something that they can access. I hope that clarifies. Just to clarify, do these strategies only apply to stop workers and not ag stream? Okay, so yes, right now we are focused in on the SOP workers. So we're working at those participants specifically because that's where the practice applied. We've had a lot of questions about the ag stream and other temporary foreign workers. So we do hope to move into looking at everybody else about Q3 next year, but right now we needed to focus in on the practice where it occurred specifically to ensure that we were addressing that first, where the batch decisions kind of pointed us to focus and where we felt it was most important to focus right now. But we do know that is a growing question, Amanda, that we've had, and we do plan on looking at that next. This is, but if Duke was AWOL and cannot legally work in Ontario, but is living in Ontario. Oh, that's a great question, actually, Jen. And it's one that we've actually been working through. Because we need to understand the impacts and what is the causation of the loss. Is the loss because they is because of the workplace accident, or is it because they're not able or available to work? So we're looking at those nuances within some of the cases that have come forward. We have a couple of them, to be honest with you. It's more prevalent than I realized. So we've been working through what that looks like. I think it's case by case basis. We really need to understand the circumstances behind that. But in some cases, we need to have a conversation with you about, like, do you have modified work that is available? Would you have offered it? Did you offer it? Are you capable of offering it? And then working through that process, similarly to somebody who, an Ontarian who leaves their employment, right? So we want to, the key with all of this is consistency. We didn't really have that consistency when we went to our practices previously. Because we deviated, and that's why we had a practice document that wasn't the same for everybody else. We really want to look to what it would look like for an Ontarian worker and then apply our policies. So in this case, depending on the circumstances, we may be looking to post-accident change non-work related as a potential policy that we may apply. But we're really going to have to look at that case-by-case basis to understand everything, and we should be having some really big conversations with you as the employer. And that's what we're really talking to our staff about and what they need to be looking at when it comes to these particular cases, because they're not easy. And I know they're not easy for you as an employer because they've left you and you had carriage. And so we need to collaborate on those ones. They're going to be, this is the short answer, but we're going to work through them. And when I say we're going to work through them, it's not just the case manager. They're going to identify those to us. And we know that those cases are difficult. And so the manager is going to be involved. And in many of these cases too, we're going to use them to have conversations at the director level as well. So, and they usually include myself as well. So we're working together to make sure that we're supporting. So will premiums be affected? So Jen, I hope that helped that answer there. And I'll move on to Sarah. So will premiums be affected? So here's the thing. When we looked in future, there wasn't a lot of cases that would have fallen into a category where we looked at suitable occupation. So historical premiums for those retro cases, we're not looking to make any changes on those, okay? So remember, we talked about they're not going to cost you anything. But really what's going to define cost is similar to what you would do with an Ontarian worker. That return to work piece. That return to work piece and the collaboration on recovery is going to be key. We're going to need to work together to really help the person come back into the program and make sure that they can recover. So similar to an Ontarian worker, it's the same process. we're looking towards, that recovery with the employer as much as possible. And we know that when we're able to bring somebody back to work, that lowers the cost of the claim, which then results in no impacts to premiums. So I hope that helps. It's always the hot button question. I think, Stefan, we talked about the notion of having somebody from employer services come in and talk about premiums, correct? Was that one of the ones that we thought about?
I think that's what we were aiming for in January, to do
Yeah.
another webinar that talks more about the nitty-gritty details of what this is going to mean on the ground.
Yeah. So some premium discussions, because while I do understand the rate framework, not the expert. I'd rather let the experts speak to that, and they're very good at it. And we've got some great resources in our Employer Service Center that would be happy to come and join us and talk about rates and premiums and what changes things. So yeah. Seeing some thumbs up for that one. So we'll make sure that we work towards that, Stefan.
Yep.
Yeah.
Sound good.
Okay.
And then in terms of record keeping, is there anything that you think, any top takeaways that you think that you'd like people to leave with? Is there any change on that front, or is that more for a future conversation?
I think, well, you know what? I think right now is a great time to have it, because we know we're heading into the end of growing season. We're heading into some changes in work. We're heading into, those challenges, but sometimes we do have those injuries that happen, kind of that overuse or adjustment to different working styles and stuff like that, because we're changing the work that we're doing. So sometimes you'll hear the term unaccustomed strain. So in those cases, what I would really say is we really need that return to work. Make sure that you're documenting that return to work piece and providing that in writing, but know that we're here to help you. You're not alone in this, okay? So if you need support and you have a claim and you're going, I don't know where to start, call your case manager. Make sure you're connecting with the case manager and having that conversation and saying, I need help. I need to work towards some return to work here, but I don't know how I can do that. So that's what we have return to work specialists here, and they can help document a return to work plan as well. And they can make sure that everybody's on the same page. One of the things that we've asked our return to work specialists as well to do is to engage our interpretive services to make sure that if we need somebody there, because the individual does not speak English, that we're supporting them in the language of their choice. So whether it be French, Spanish, whatever the case may be. Return to work, we have French speaking return to work specialists, so that's a bad example, but you know what I mean. We're looking to make sure that we're communicating in everybody's preferred language to make sure that the message is being heard and we're able to provide those services. I see a question again. In the case of an open claim that continues while the worker is in his or her home country, does communication with the employer continue to take place? What recourse is available to the employer if there are any concerns to arise? So yes, similar to an Ontario worker, we're going to continue to communicate with you. We're going to make sure that you're aligned, that you're understanding where everything is at, and we should be providing that same update as if the person was an Ontarian worker. So if somebody's in on a claim that, they live in your community, they work for you, that sort of thing, we would expect that we would be following up with you, the employer, as well as the injured person. We should be doing the same thing in these cases, and we've made sure that our staff understand that, and they should be following up. Now, one of our biggest barriers is the technological challenge. You'll remember from the beginning, we talked about the notion of the fact that we pick up the phone a lot. We're really good at picking up the phone a lot, but what you know about your staff is that they use WhatsApp. So we're looking towards seeing what we can do to help break down those barriers when it comes to communication, and what we can use, because we obviously have rules and privacy concerns and everything like that we have to follow. So right now we're working on that to see if there's opportunity to look to alternate communication options than what we have today available to us through our standard methods, which is picking up the phone. Okay. It's a very good question. How do workers get paid while they're in their home country, specifically speaking Mexico? So, Lori, I'm guessing that this question is coming from the idea that they can't cash Canadian checks in Mexico, and we do know that. Yeah, yes, resounding yes. So, good news. We've been doing a lot of work on wire transfers. So our Treasury Department, I literally have a meeting on this again tomorrow. We're refreshing our wire transfer documents, because I know we've had a lot of barriers with our wire transfer documents. So we've done a refresh on those, and we do have the option to do wire transfers to them in their home currency if they don't have a bank account that's available to them here in Ontario. So to put direct deposit into their account. So we are doing some work on wire transfers, and one of the other things that we're looking towards is at that I'm going to call it the pre-repatriation meeting that we have with Return to Work if it's necessary. We are going to look to make sure that Return to Work sits down with them and has some of the paperwork available to them. We're putting together what we call a pre-repatriation package that will be delivered, especially if somebody's going to have to get healthcare back home, that the Return to Work specialist can help support with that and just kind of go over and kind of remember you need to fill this in, you need to go, and that sort of thing. And the other thing that we're also looking to provide is our Treasury Department right now is putting together a wire transfer presentation that can be externally facing. And the consulate is keen to receive it so that they can also support if there's any questions that come, because we've learned so much from them that they have offices throughout the country that may be able to support this kind of work. A lot of workers are very leery of accessing those funds. Oh gosh, okay, so that's good to know. I'm gonna make sure that I pass that along tomorrow in my meeting about wire transfers to our Treasury Department, just saying that, you know, we may in fact see an uptake in Mexico for these particular asks, noting that note. So thank you for that, Lori. That's good intel for us. See, there's a lot of newness for us, and wire transfers became a lot newer to us throughout the pandemic. Specifically when it came to Mexico. I mean, we had tragically we had the loss of some migrant workers due to COVID, and you know, we learned a lot on how wire transfers work, specifically in Mexico, and what we need to do on our end to make it easier for them to access those funds and their widows. So we've become attuned, I would say, and how to do it a little bit better than we have historically. I always learn something from these stuff, Stefan, always.
Yeah.
And I
Yeah.
appreciate your membership for that.
Yeah, no, I agree. Good question so far. Kendra, so my experience with changes in rules or strategies is, I mean, ideally everything works smoothly and like there's zero bumps or hiccups.
Yes.
If there are, let's say some, I think an earlier question was if there's concerns or maybe people are seeing things that just don't make sense or so how are concerns like that, or maybe people see unintended outcomes
Yeah.
and they maybe even see a pattern. How are those relayed, and how kind of what are your thoughts kind of monitoring the rollout, and to what extent are you looking to folks on a webinar like this one or associations to kind of give you real-time feedback on any such questions or concerns?
Yeah, for sure. So a couple different things. So of course, one of the things is always, if it's case specific, bring it to the case manager. If the case manager really isn't the right level, you can always bring it to the manager itself. The good news is because we have all of these cases isolated, if it's a physical injury to our team in Guelph, they start to see those unintended consequences quite quickly, right? They tend to have those experiences or aha moments. And the wonderful thing is because I'm located out of our Waterloo office, which is connected to our Guelph office, I've known these guys for years. I've known the team that works there for years, and I meet with them on the regular. Unfortunately, they're in office day. I can't go to tomorrow because I'm going to be in Toronto for a different meeting. But what I can say is we do stay connected and we do have those conversations. So that's level one. Level two, if it's more of a global thing, so you're starting to hear it, Stefan, always you can come to me. That's not a problem. And if I need to redirect you to another area, we will. What we'll also be doing is, so you'll recall me saying at the beginning, I was previously in the role of stakeholder relations prior to coming into this role as project director. And that was how we connected historically. Stefan was in that role. I kept a lot of those responsibilities for agriculture as I was working on this strategy, because I felt it was really, really important to have that connection with the community without causing confusion. My biggest concern was always that causation of confusion. So slowly we're going to start bringing in a stakeholder relations manager to really work again outside of myself to the agriculture work. And so we're going to make sure that you have that context and that contact. So it's going to be Jennifer Singleton. And she's gonna, my plan is to bring her with me to some of these events. She just wasn't available today, so I could introduce her, but know that you're gonna have all the love, all the support as you continue down this path with us, and make sure that you have your voice can be heard or concerns can be raised to the right party. We don't always have the answers, but we'll look into it and make sure that we can get them for you.
Yeah. No, I think that's really important, and it's really important that you have that you're open to that kind of feedback and real time
Absolutely.
sort of observations and questions. Thanks, Kendra.
Yeah.
Are there any other questions from folks on the call? Either you can think at this point, I'll take the chance and unmute yourselves, and or type a question.
Hmm. Strategy related questions still would come to me at this point, just because I'm still fairly engaged in this work. I've got about a year and a half left of work to really do on this. I know that seems really long, but it's a lot. We've come a long way in a very short while. And a year and a half is part of it is observation to ensure that, the intended consequences are, flowing the way we want them to. So some of it's just a monitoring period as well.
Okay.
Yeah.
Good. Seeing no other questions, Kendra.
Mhm.
Just a reminder, we're going to be, once we wrap up, we're going to be putting this the session up as a recording and circulating it to folks on this webinar. I want to thank Kendra for sharing her insights. I mean, you're one of those that rare creatures that knows things from that policy side to the implementation. So it's nice to have your broad perspective. Thanks, Deanna, for setting this up. Thanks everyone for joining us over your lunch hour.
Thank you so much for having me. I really appreciate it.
So we'll be doing more of this. We'll have some more Kendra time
Yes, definitely.
in January and February, probably. So stay tuned.
Absolutely.
Bye,
Thank you. All
everyone.
right.
Have a great day.
Bye. Take care.